you're not allowed to go in with your family members at all if they go into the hospital. And it's something for people to really consider when they think about staying home or going out, because you will be in the hospital alone. And when you think about that, it's quite anxiety filling, right? To illustrate how fast and quickly people can feel anxiety. Anxiety, much like COVID-19, is contagious. So once people are feeling anxiety, it can grow, and other people can feel their anxiety, and you probably even feel it as I'm talking about it now, your own anxiety increasing. And so there are many ways that we can address anxiety, both and I think that anytime we think about addressing mental health issues, we want to really think on a dynamic perspective of, both how do we address the individual, our family, and the community, and then also how do we address the biological symptoms, the psychological symptoms, the social symptoms, and the spiritual ones. So if we think spherically about all those different pieces, we can come out with a good outcome. So how we can do that is, as an individual, right, we can do things that are less anxiety provoking. Because one thing we need to understand as a community about anxiety is that we need a little bit of it. We have to have a little bit of it to get out of bed in the morning. So anxiety is one of those things that we never fully cure people of having. You need a little bit to get going in the morning. And that's really important at this time when we think about maintaining routine. Because what we know from times past and currently, people can actually take on vicariously things that they're viewing. So if you see, pictures of people's poor health, or you see pictures of people dying, I know they've been showing some, pretty explicit pictures about, what they're doing with the dead in different parts of the world, because there are so many people dying. And that can be vicariously traumatic for people, meaning that they feel the trauma that's occurring, or the grief in this case that's occurring, without being a part of it literally. So that can be just as affecting psychologically as if you were there. And so we want to limit our exposure to that, because we will all feel it. Another thing that we can do is to also, proactively look at the things that we can do positively. So when we learn about what we can do to safeguard ourselves, we can practice those, measures, like washing our hands, like making sure that when we bring things into the house that they're sanitized. And we can also empower children while they're at home, to teach themselves how to carry out these measures and make decisions themselves, right? So we can help them learn how to be empowered too. Humor is a great way of dealing with anxiety, right? And so viewing comedy, laughing with friends, we can still connect via technology. One of the positive factors to technology, being able to connect with each other still, and have a regular conversation with our friends like we would normally do. Make that chai, make that tea, and have it over, Zoom, for example. We can also do things like guided imagery, or deep relaxation, because a lot of what people are feeling, in addition to anxiety right now, is grief. There's a lot of grief, and it has to do with not just human beings, but also sort of grieving their routine, the loss of their routine, the loss of their work, the loss of, just loss, all right? And they may not identify it as grief as such, because they're not used to thinking about it in that way. We're used to thinking about grief in terms of losing people, but we're not used to thinking about grief in terms of how it affects our daily life, in terms of our routine and our system.
Is there anything you would recommend that we do every night before going to sleep, or right after waking up, to be on a more stress-free, stable, motivated mindset?
Of course, and it depends on where you are in your life. Of course, spiritually, we have all kinds of dua that you can make every night before you sleep to try to put your mind at ease and rest. That certainly, would be a good recommendation for those who, are inclined to do so. For those of you who may have not tried it before, maybe it's something you try for the first time. But we also have other things like art therapy. So for example, we have something called a tangle, where you draw a line on a paper and then it's kind of like doodling. People are more familiar with calling it doodling. And there's research that suggests that if you doodle or you color, there's adult coloring books, if you color for 20 to 25 minutes a day, that you will improve insomnia. You will be more relaxed when you go to sleep. Your tasbih and do dhikr. There's research that suggests just rubbing the beads reduces anxiety. It gives people more calm feeling. As well, if you're a person that thinks a lot, like you work hard, like you do Salam, and you have so much on your mind that you're thinking about, you can write down on a piece of paper all those thoughts and put them on your nightstand to let them be for the night, so they're there in the morning. And you can pick them back up when you wake up, but that sometimes allows people enough space to relax and go to sleep. There's also, physical activity. Physical activity, for some people, that's energizing and will wake them up. For other people, that helps to relax them to go to sleep. And then lastly, I would mention that if you are one of those people that has trouble going to sleep, don't just lay in bed while you're not able to go to sleep. If you truly can't go to sleep, get back up, either watch something on television that you would never watch that will be totally boring to you, or read a book. A lot of people don't read, so that usually puts them to sleep. But do an activity where it will make you drowsy so that you can, and then go back to the bedroom and go to sleep. We're finding that people are so much on the run and have so busy their lives that they're not used to being at home necessarily with their loved ones. And people being into this forced space of being present for one another has, for some people, it's brought them very close. And for other people, it's brought more conflict because they're not used to being around each other. As such, actually, we recognize this because it has actually brought a lot of conflict for people. We are on Sunday night, we're having a webinar for couples to try to discuss the difficulties they're having and then look at ways to de-escalate when communication gets rough or tough, because really we have to stay home right now and there's not really a way of avoiding each other. And if you're not used to being around each other, yes, it's an opportunity for connection. And we have to, sometimes people are not used to doing that, so they need some help in how to do it better. Creating fear, right? So last night I was even watching a video on YouTube. It was a doctor, a medical doctor, who was talking about exactly how COVID-19 works in the body, which also can be anxiety producing. So I don't advocate for people to go watch all of that unless you are not affected by hearing about the medical process. Domestic violence is one of those areas where I have a no tolerance policy. When somebody is reaching the point in their relationship where it has become violent, one person needs to leave the situation and take shelter with a family member, or it happens unexpectedly. You don't even worry about who you're going to call for resources, just leave, right? Somebody needs to leave the room, leave the house, get out, let things diffuse. Staying and trying to de-escalate somebody when they're angry just really doesn't work. Even for a mental health professional, there are limits to de-escalation, right? What happens when somebody's angry is that their brain shuts down.
Right.
And nothing that you say rationally gets in there because it's closed. And so, because this front part of our brain, which is responsible for executive thinking and functioning, it shuts down, and we go back to this more basic part of our brain that's considered more the reptilian, the basic drives and needs when we're angry. And so all of that complex thinking is out the window. So when you're dealing with somebody like that, you just need to get away from them. Once you get out of the environment, you can call anybody you need to call, whether it's 911, whether it's, you know, a family member, whether it's a shelter. The biggest point is whether you're male or female being abused, just get out and then, you know, seek those resources. There's, you know, oftentimes not enough time. We'd rather have you alive, you know, and struggling than to have you not alive at all. With depression, we have mild depression, moderate depression, and severe depression. With mild depression, there are some people that even argue with everything that's going on in our world right now that it's just smart to have a little bit of depression, because the world right now is suffering. So to have depression, every emotion that we have has positive and negative qualities. And just like everything else, too much of anything is not a good thing, right? So too much happiness usually leads to what we call mania or euphoria. And that also is a sign of a mental health condition. So we don't want too much of that. We also don't want too much sadness. A little bit of sadness might actually fit the situation. So we have situational depression. That's normal. What we want to do is teach people how to sit with those feelings and be okay with them, right? Normalize the fact that, you know, something bad happened and you feel sad about it. That's pretty normal, and actually a good thing that you do feel sad about it, because we wouldn't want you to feel nothing about it. We don't want you numbing your feelings. Your feelings are a blessing from Allah to help you navigate this world. They're signs, they give your intuition clues about how to take next steps. The whole point of the psychopharmacology around depression is that the medications are supposed to give a boost to doing regular therapy, right? So the same effect that an antidepressant, for example, has on the brain, you can achieve with psychotherapy within 6 months. So the idea is that the two will cross paths after about 6 months. And then the psychopharmacology becomes less effective, and the talk therapy continues to rise in terms of its effectiveness. So at that stage, at that moderate stage, we do want to start seeking help. And then if it gets too severe, we're looking at things like suicidal ideation. If it gets to that point, if somebody's talking about wanting to hurt themselves, or they have a plan, if they have a plan, you really want to get others involved. These are teams of social workers or licensed mental health care professionals, along with law enforcement is involved somehow, but they come to assist and evaluate if the person needs to be taken for observation, right? So it's meant to be a social service for the public, to be helpful, not harmful.